finally, to cut waiting times as dramatically as possible, our approach must be totally unburdened by dogma. Working people will expect nothing less. So today, I welcome a new agreement that will expand the relationship between the NHS and the private healthcare sector, make the spaces, the facilities and resources of private hospitals more readily available to the NHS. That's more beds, more operations, more care, available to the NHS, treating patients free at the point of use, targeted at where we need them most. A partnership in the national interest, cutting waiting times, working for you, delivering our plan for change.
These centres and any private organisation within the NHS cream off the low complex, high volume procedures, leaving the complex stuff for the NHS.
So you're thinking that these diagnostic centres, the private ones, will be able to choose what kind of work that they are contracted to do?
There's always exclusion criteria whenever you refer anyone anywhere, particularly private organisations. Both the private sector and the NHS will both be given £1,000, but the private sector may say, well, we don't take patients with a lung condition or diabetes because we don't have the means to look after them afterwards, whereas the NHS don't have that choice, and they will take those very complex patients, have to look after them for days afterwards because they take a longer recovery, but get paid exactly the same. And the problem is then it starts to destabilise the NHS services. They may collapse. The private sector goes, okay, well, we're the only player in the game now. Let's put up our charges to the government. And that whole thing costs us more. That's the real risk here.